Everyone, I'm Dr. Bird. This is Betty Delass. Now, did I say that actually?
Delass, yeah.
Delass.
Yeah.
Okay, so she is a PT first, but you have specialized yourself into something very different.
Yes.
You went a little bit different than the general, normal style when you're done graduating with school. It was not straight to, well, you tell me, what was your path?
Yeah, I'll start back in the beginning. So I went to school at the University of Wisconsin-Madison, both undergrad and PT school. So I had my undergrad degree in kinesiology, exercise and movement science, and then doctorate in physical therapy.
Right.
And then after that, I specialized into pelvic floor or pelvic health. And so I went to a bunch of courses through Herman and Wallace Institute, and they're one of the major ones that do a lot of pelvic floor training for physical therapists. You can be a chiropractor, a DO, RN, anything that's in your scope of practice, you can take those courses to specialize in. And then I've done dry needling courses, Graston courses, kinesiotaping courses, a lot of endurance athlete stuff. So yeah, that's kind of been my path.
What is the most common thing you see as a pelvic floor specialist?
The most common thing? Most common thing that I see would probably be things related to diastasis recti, prolapse, painful intercourse. Probably painful intercourse is number one.
Okay.
Yeah.
And this question is definitely something that most people wouldn't realize, but is a pelvic floor specialist only for women?
No. Every person and every body and everybody has a pelvic floor.
Very good. Okay.
Yeah.
So let me ask this, because my assumption, I'm just going to make fair assumptions, is who do you see more often?
I specifically specialize in owners of a vagina.
Very cool.
Preconception, pregnancy, and postpartum.
Okay.
So there's many of us that specialize in multiple different areas. So whether it's like they do just males or they do all genders, there's transgender, there's gender reassignment, there's oncology, there's pediatrics. So like you can even subspecialize further. So like that's kind of where I've niched into the pelvic floor world. It's more the preconception, pregnancy, postpartum.
Gotcha.
That's my passion.
Very cool.
Yeah.
So if you're seeing someone, let's say preconception, is there a certain amount of time do you want to see him? Is there like, what's the goal? I mean, it's somebody goal oriented, I'm assuming.
Yeah, sometimes, yeah. So it totally depends, obviously, right? And so a lot of times I'll see people for infertility things. So like, if you think about it from a big picture perspective, is if this isn't happy down here, it's usually not a good time or environment to grow a human being.
Sure.
So we can work on things preconception wise to really optimize that. And then also too, just getting familiar with your body and knowing like, okay, what do I need to do? Or if you're having painful sex when you first get married or whenever you're having sex, and then you're like, this isn't good, like we can resolve those things prior to you getting pregnant. So then we can prevent other further issues down. So think of it as like early childhood intervention, right? Like the sooner we intervene, the better the outcomes are going to be. And so if we can do that more upstream, which is why I kind of focus at preconception, pregnancy, postpartum, I still get a majority of people postpartum because they're like, oh crap, I have a lot of issues.
A lot of issues,
yeah.
Sure.
Just like anyone for surgery. But we also know too with research that if we did prehab before we did a knee surgery or shoulder surgery, outcomes are better, right?
Yeah.
So why wouldn't we apply that down here?
Same thing.
Yeah, same thing.
So this is not one of our questions on here.
Yeah.
But what is the conception or what is the idea from the medical community about pelvic floor health? Is it a major thing, or is there a lot of, maybe I don't want to say older docs, but let's be honest, some of the older docs that may not know a ton about the pelvic floor and just think that that's not really an issue. Yeah,
I would say most people, whether it's in the medical community or just general lay people in general, like don't know about pelvic floor. They just do not know.
It's not necessarily really taught heavily.
So that's been a hard thing, and that's partly why I did my own practice, is so that I don't have to go through those red tapes of things.
Sure.
And I can go directly to the patient and be like, hey, this is something you should be aware about, and they're like, oh yeah, absolutely, like I want to be on top of that. And so I'd say more in like the doula midwifery side of things, more holistically, chiropractors too, of like, oh, this is a thing, like, and they're directing people that way.
Right.
Where your typical standard medical system is like, oh, what are they going to do for you?
Yeah.
And they just don't know.
Right.
Yeah.
Because I'm going to assume as well, most of the stuff they're doing is not medication heavy type of stuff, because it's PT.
Yeah.
PT is still exercise, still manual therapy, it's interventions
All of
that
that.
are going to be non-pharmacological, non-surgical, which is great because there's a lot less recovery that has to happen. And there's always improvements we can get with exercise or whatever it might be. So very, very cool. Okay. We handled what schooling do you have? Because how long was the extra part? That may not happen for this part of it. Like,
sure.
You said you did it through who?
Herman and Wallace.
Okay.
And so they're all separate. They have a 4-course series to go through like their major section of pelvic floor rehab.
Cool.
And then they have multiple other courses, so you can specialize in oncology or pediatrics or trauma-related therapy, and take more in-depth nutrition.
Nice.
There's pregnancy courses, there's visceral courses, there's there's a whole world of courses within the institute itself. They have in-person courses and online courses. COVID really separated those two.
Very cool.
Yeah.
Very cool. And then, how many have you done?
Oh gosh.
Lost count.
7+.
7+.
Yeah.
You're going to start teaching for them at some point in time or take over.
Maybe. I don't know. Yeah.
You take enough courses, you're like, why aren't you just teaching this stuff?
Yeah. And so typically my next route with them would probably be more to TA or something like that. So
very cool.
I'll do something like that probably before I would actually teach them.
So I think we may have answered this as well, but what was it about pelvic floor that really intrigued you and got you down that path?
Totally. So I've always been fascinated by pregnancy, postpartum, the fact of growing a human being inside of you, giving birth, and the fact that something can fit out of there. This is just bizarre, right?
Sure.
And so knowing all that stuff and just being really interested in it, and then having kids myself. And so when I step back and I think, man, I'm educated, I know my stuff, I exercise, I'm pretty healthy, I have a support system, I have the wherewithal to navigate through the medical system, and it was really hard.
Sure.
So my passion really comes through about we need this as beings of growing children. We need this rehab because it's literally life changing. Every single patient I work with is this changed my life.
Yeah.
How come everyone doesn't know about this?
Right.
And I'm I know. I'm trying to change that one pelvic floor at a time. And so are other pelvic PTs, obviously. But yeah.
It's probably hard because it's not a common conversation for people. Oh, hey, I had so-and-so help me with my postpartum. Or my whole pelvic floor. And people are we don't know what that even means.
What are you talking about?
Pelvic floor isn't a common thing for anyone that we bring that to any conversation. Yeah,
I think social media has helped bring that about too because we're able to talk about it. People are gaining more interest in pelvic floor, pelvic floor this, and it's kind of a buzzword, so to speak. And so that's really getting people intrigued of what's that? What's that? And so that's helping. We're getting there. But the problem is we don't have enough of us either to go around.
I would assume not. I mean, if we're being honest, I think I've heard 3.
Yeah.
In this city alone, and it's I don't know them personally.
Yeah.
Now I know. Now I know one.
Yeah.
But I just don't know it.
Just don't know. Yeah.
It's kind of unfortunate.
It is. It
very
really
unfortunate.
Is. Very unfortunate. So I also often say too, just like any muscle anywhere else in the body, we would do rehab on that.
Right.
We're growing a human being.
Right.
Giving birth.
Right.
Musculoskeletal changes happen tremendously throughout pregnancy. Why aren't we doing anything?
Right.
So
big time.
Yeah.
Very cool. Okay. Let's ask this question. What does an OB or an OBGYN look for during that postpartum checkup, 6-week post checkup?
Yeah. Obviously, I'm not one, so I don't know exactly everything they do, but generally speaking, they're checking to make sure uterus is back down where it is, ovaries look good, there's no abnormal bleeding, scar tissue's healed, you're healed from a birthing perspective.
Right.
They typically are not looking at the musculoskeletal system. They might check to see if you have a diastasis recti or something quick like that. They're oh, you have a little bit of pain there. That's normal. You're leaking. That's normal. And I'm just any of those things.
Not normal.
Go to PT.
Right.
Go to PT because we can do all that stuff and really optimize the whole system afterwards.
Very cool.
Yeah.
Okay. So when is the best time for someone? This is not on the question, but mom is a new mom.
Yeah.
Okay. How quick would they need to see you afterwards?
Yeah. Generally, I see people 2 to 4 weeks postpartum.
Okay.
Yeah. Okay. I don't do any internal work at that time.
Makes sense.
Because they're not medically clear, they're still healing, that kind of stuff like that. But we can focus on breath work, gentle core activation, glute activation, just knee surgery. You're where's my quad? Have no idea where it is. Same thing with the glutes, core. You just grew a human, gave birth, whether it's C-section or vaginal. And it's like, weird, my mom butt.
You're like,
wow,
don't-
check out this mom butt.
Yeah.
So you have to figure out how to find those glutes again to really, really optimize that system and the pelvis in general, from
Right.
the spine and the pelvic floor.
Cool. Okay. All right. Next one. What is the question you get asked most as a pelvic floor specialist?
Yeah, I kind of touched on it a little bit before, but usually it's like, why does everyone not know about this? And why isn't the standard of care, like everyone should go to pelvic floor therapy? That is the number one question.
Let's change it a little bit and say a person doesn't know anything about it.
Okay.
Then what is the question? If you say to a stranger, I'm a pelvic floor specialist, they'd be
Like, what does that mean?
Why does that matter to me?
Typically how I answer that question is I kind of want to relate it back to them so they can understand. So basically, I help people stop peeing their pants, get rid of low back pain, and get rid of unwanted pain during intercourse.
That's perfect.
Yeah.
Keep it super
Yep.
simple.
Super simple. That's what pelvic floor PT is from my viewpoint of who I treat and what I do. Obviously, there's many more avenues. Yeah. But
Okay.
that's what I do.
Got it. All right. This one I think is we probably touched on it, but like men can totally benefit from this as well.
Totally.
They don't have to have a
No.
vagina to be able to get treated
Yep,
and have a pelvic floor.
They still have all the same muscles except for like 2 down there.
Oh, really? Okay. Yeah. But how many men do people actually? How many men actually go to a pelvic PT?
A lot.
Okay.
Yeah. So it's really common in the biking world from sitting on a seat and getting like some nerve irritation, tightness in the pelvic floor,
Right.
and then also post prostatectomy.
Okay.
So think about scar tissue, things like that, trouble with urination, incontinence, all that kind of stuff. So those are 2 really common ones.
Okay.
Yeah.
All right. Now you don't have an office.
Correct.
I love this. You
Yeah.
don't have an office. So how do you? What is I don't want to say a typical session look like, but time wise, what's it going to be like? Where are you going to be with a person?
Mhm.
You set up. Going back to the van. How do you set it up?
So typically I do a 15-minute free phone consultation first with people to kind of hear their story, tell them what I do, how I do things, and the way I describe that is I'm a mobile concierge service. And so I come to your house or your office. I do see a couple other professional medical providers that are like, I'm working, but can you come to my office? Absolutely. And I just leave my table in the car then and bring my Mary Poppins suitcase in that has all my stuff in it. And we just do it there, or I bring my table and my Mary Poppins bag into your house and we set up shop. And a lot of times too is a lot of my patients are moms. And so I get it from a childcare standpoint or having to like pack up everything and bring a diaper bag and what if a nap schedule and all this stuff like that. So it makes the convenience of that really nice to just come to mom, because that's really what mom needs at that point in the stage of their life during that childbearing years of like, oh, someone can come to me, I don't have to go somewhere.
Right.
It's so much nicer that way. And then I am starting to have an office. I am. August.
Okay.
In August, I am going to be renting space out of beautiful Mountain Burst Suites in West Jordan.
Nice.
Yep.
Very
And just
cool.
on Thursdays for right now.
Okay.
Because of the need that's there, I just can't see everyone being mobile. And so I'm doing 1 day a week in clinic so I can kind of go back to back to back to get more
There
people
you
off the
go.
wait list.
Yep.
So yeah.
Very cool.
As well.
Where's you like if you?
Yeah.
I'm assuming you have a network of people somewhere.
Yeah.
Where are they? Like your other colleagues?
Yeah.
Where are they?
They are all like there's like I want to say probably 75 to 100 of us.
Okay.
Yeah, and from a like if I back that up a little bit, it's a relatively newer profession. It's been around for like 25 years, but like really like turning over. So there's a lot of new people who are just getting started in it, and they need more mentorship and guidance and things like that to really fine tune their skills. And they're in all over the place. There's other cash practices like myself or out of network places. And then there's also people in hospital systems and they're really everywhere. It's just spread out. And probably not as many are like as vocal on social media.
Sure.
As what I'm trying to do.
Right.
So, yeah.
You start down this path or you start this program or whatever it is. I don't want to call it a program, but
Mhm.
you start care. People want to know, is there a light at the end of the tunnel?
Right.
How long is this going to take?
Right.
And I got this question just the other day for neck.
Yeah. Yeah.
Why can't this get fixed in a day? I'm like, well,
You're right.
I'm like, I'm good. I'm just not that good. Like,
yeah.
is there a light at the end of the tunnel for people?
Totally.
For your one person that switched from helpful pain to get me back into performance, which is totally different.
Yeah.
There's some of the same, I don't want to call them techniques, but ways to help them get better, and it's still improving pelvic floor, abdominal breathing, that type of stuff.
Yep.
But But is there a lighter than a tunnel for some of these people?
Yes,
Is
100%.
it a pain marker or is it a functional marker?
Both.
Very good.
So
Cool.
I'm gonna step back and answer that question how I want to answer that question, which will answer the question that you're asking.
No, you have to answer my way. I'm just kidding.
So I generally tell people that within 2 to 5 sessions, you should see a significant difference, if not sooner.
Right.
Okay, so you will know, like, this is the direction we should be going. We're making changes. Symptoms are getting better. I'm able to do more. Things are changing. And quite often times they're like coming to see me for one thing, but then all of a sudden they're like, and I'm pooping better, and my low back pain went away, and this went up, and they're like, oh my gosh, I didn't even realize this was a pain until it wasn't there anymore. And so
Right.
like we're uncovering things through that process. And so what I like to take people through is not necessarily, I'm kind of a fan of not being like, oh, I think it's going to take like 10 sessions, because we really don't
You
know.
just don't know.
We don't know. So
People are non-responders.
Right,
Yeah.
right. But what I like to then take that from is like, okay, I'm going to be able to tell you like you're in the right place or not, for sure. And then if you're not, I'm going to help guide you to what else you need so that we can continue making progress. Because if you're where you should be and we're
Right.
getting stuff, usually there's other things that are playing into role that might need medication or therapy or other things, or massage therapist or acupuncture, chiropractor. Like, we want to make sure we're giving the person better. It's patient-centered care, right?
Very cool, yeah.
And so when I think about like the continuum of treatment philosophy, what I think about is that first phase of treatment can be anywhere from 1 to 4 visits. We're just kind of figuring it out, both me as a provider and on the patient side, because you're going to bring up stuff that you didn't put on your intake form, that
Right.
you didn't say the first day, and you're like, oh yeah, by the way, this, and it's like, well, that would have been nice to know, like, back here, right? You can appreciate that.
Yeah.
And so that first 1 to 4 visits is really just figuring it out. And then anywhere from 2 to question mark is symptom resolution. And so we're figuring out, okay, what are the layers of the onion? How are we peeling these back? How are we getting symptoms resolved? And then you're like, ooh, I feel really good. I don't have any symptoms. I'm not peeing my pants. I don't have pain with sex. My low back pain feels great. I can pick my kid up. And you're like, I don't need therapy anymore. And you're like, me.
You're
I'm like,
you're
wait
close.
a second. You were very, very close. And that's typically where I transition from like a 1 time a week thing to, okay, let's go every other week or once a month, depending on the person. And then we're more going to that building resiliency phase. So we're building resiliency in your system. You're doing most of the work, but still checking in with me, doing some manual things like that, advancing some stuff, tweaking some stuff along the way,
Right.
depending on your goals. And then after you've gotten to through that resiliency phase and you're feeling good and like we can throw things at you and you're not flaring, then we're more in that optimizing phase. And so once we're in optimizing, it's really, you just call me if you need me.
That's awesome.
Yeah.
Yeah.
So
that is good to, for one, I think people want to know, okay, if there's a kind of a timeline that we can say, okay, that gives me an idea, for one. And the biggest questions are always, what is it? How long is it going to take? What's it going to cost?
Totally.
Because there's going to be some value behind it as well. It's going to take some time, but like you're changing your life, you're not just changing your symptoms. Right?
Totally.
Totally. It's
bigger. It's bigger than what I'm doing.
That tertiary question, the bigger question, not just I have pain question. It's like, well, what's it stopping you from life? So
Totally.
you can answer that, like you've got them hooked, or you can do anything you want.
And typically what I'll say to that is, even myself as like a practitioner, it's so much bigger than what the patient's coming to see me for. Because if even bigger than that, like if mom isn't happy because she can't work out, or she's peeing her pants all the time, or she's worried about this, or prolapse, or like any of those like things, like that's very impactful in your quality of life. And so if I can take that burden away and help them take that away, manage it, then mom's going to be a better mom. Mom's going to be a better mom to her kids, better wife, better servant to her community. Like it's a rippling effect, and that's my drive. That's my driving force.
I love it. Yeah. Very, very cool. I think the last thing is really, where can people find you? Like where are you at, and like, how's the best way to contact you? We of course want to be a way to help patients that have those issues that we just don't take care of here, because we all have our specialties, right? Let's just be completely honest. We have our specialties, things that we love to work on. There are other areas, it's like let's just be honest, out of my scope of practice. Or out of my comfort
Or
zone.
someone's more efficient at it than I am.
You know what? Totally true.
Yeah.
And I think there are some times where it's like, you know, it's not that you're just like letting them go. It's like, no, let's just feed to the right person.
100%, and that's the way it should be. Like
perfect. So how do we get a hold of you?
Yeah, so you can find me on Instagram as my main mode at Dr. Betty Delass DPT.
Okay.
So DrBettyDellass DPT.
Not a short handle by any means, right?
Nope. And then my website is www.rebornphw.com.
Okay.
And then and all of those things, you can also find me on Facebook. You can find all the ways to contact me. But the best way to like see consistent content and things like that is Instagram is my main like focus.